Dr. Sam Schroetke here at Physical Therapy and Hand Clinic of Hillsboro, and we're bringing you another edition of Technique Tuesday, continuing our theme of hip or sacroiliac joint pain. I did a series of 4 videos, I think, already for people who are responding to some kind of hip extension. If you didn't respond to that, or it made you worse, which is also not responding, give this one a try. This is going to be repeated hip flexion. We'll do it 3 or 4 different ways. As a review, most people who present with hip pain, it's in the front. Okay, this is where the hip pain is most likely going to be. If it is pain that's here on the outside, I would work with your physical therapist to rule out the low back, because oftentimes pain in here is originating from your low back, not always, but often. And if it's your sacroiliac joint, you're still going to want to rule out the low back first. But if you work with your physical therapist, there's screening tests we can do that are pretty reliable when it comes to, we're trying to figure out if it's sacroiliac joint or low back. Okay? So let's just say we know it's sacroiliac joint or hip pain. We're going to try these exercises. Okay? All right. So the first one is going to be repeated hip extension in line. Okay? So for this case, we're going to say I have left-sided pain because it's going to be more convenient for the video. You're going to lay down, and we'll start like this. And so whether I have hip pain or sacroiliac joint pain, we're going to try this. I'm going to pull the leg up and then pull it in as far as I can, hold about 1-2 seconds, and then down. It was a fast 2. It's okay. Pressure on, pressure off. Pressure on, pressure off. You're going to do 10 to 15 reps. It might be a little uncomfortable, but as you go, it might become more comfortable, or when you're done, you feel better. It shouldn't feel worse upon repetition. And you should, if it's a joint issue, and we're trying to reduce that joint obstruction, you should get more motion as you go, okay? So 10 to 15 reps every 3 to 4 hours, so say 5 to 6 times a day. I had a guy the other day, and he actually has hip pain. Most people with hip pain are going to respond to the hip extension, which I did in previous videos, but he actually did respond to this better. And it was painful for him too. So the 2 things that were painful for him were flexing his hip and externally rotating this. And we found that this helped him. And the more of these we did, it became easier for him to flex his hip, and this became way less painful. So those are things you can do to test to see if it's going to be appropriate for you. Look if it not only reduces your pain, but if your mechanics, your range of motion become better. So repeated hip extension in line, or for hip pain or sacroiliac joint pain, 10 to 15 reps working to get to end range. That's super important. And you're going to do it every 3 to 4 hours, so 5 to 6 times a day. All right? Check with your physical therapist or physician before performing these exercises to make sure that it is appropriate for you. Make sure to check us out on Facebook, like the YouTube video, and make some requests, and we will answer them for you. All right? Thank you.